Hello, how are you?
I'm well, Cynthia. How are you?
I'm good.
Awesome.
So I wanted to ask you a few questions for the GNSA.
Okay, great.
So my first question is, what is your title?
Well, as of right now, I am the interim director for the School of Nursing for George Mason University. And prior to that, I was the assistant dean for the basically graduate programs, non-PhD graduate programs, so MSN, DMP.
Okay, great. And please describe your nursing work and career. Example, how did you get into your current position?
Or research. Okay, so my career has been primarily pediatric nursing and nursing leadership. And they do actually relate.
Yes, I agree.
Some of the skills you use in pediatrics, you use in your leadership roles. So I have been, a pediatric nurse, a NICU nurse, an ER nurse, and peds ER nurse. I've also, floated through other different areas. That's my nursing. About 6 or 7 years into nursing, I was promoted to the director of a pediatric unit, which led to the director of a pediatric emergency room unit, which led to the director of all three, not just separately, of an outpatient pediatric unit, which led to the director of OB and nursery and NICU. So pretty much the director of the first floor, except ED. Right. But about a year later, the emergency room was added to so I was the director of the first floor at the hospital I was at. So it was fun. Yeah. And then I went back and got my nurse practitioner because I really felt like I was missing that patient interaction, and finished that up while consulting for a community health center, which I helped to plan, open, and it is currently has 3 sites now, but it still wasn't my passion. So went back in and worked as a nurse practitioner for a while, and did some sane nursing, did that kind of stuff. Was still raising 3 boys, and then found a position to be the director of a pediatric ER at a children's hospital, which was really kind of fun. Did that for a few years, and then went back and got my doctorate, and I ended up in academics. So here I am. So I came here to teach, and now I am the director of the School of Nursing. So I kind of feel like sometimes it's your passion is what you really love doing, but your calling is what you end up doing.
I agree.
Sometimes, yeah.
I totally agree with that. How would you describe your leadership in the nursing and healthcare field?
My type of leadership, I would say, is very, I try to be very authentic in how I approach people. I feel at the core of every organization that is successful is happy and satisfied workers. And so here it would be faculty and staff, as well as our students, because our students really are that's our patients, in the real world. It is our clients, and so we need to make them feel part of this, and a lot of our graduate students really do become pseudo faculty in a way. So we love to have our students working with our undergraduates, almost a novice to expert approach. And so I do that. I also am a little bit of a transformational leader in that I truly believe that we should always be in looking at the evidence and informing our practice. So I bring that into my leadership role as well as my nurse practitioner role.
And I agree. That's basically what I'm doing as a graduate nurse, student teaching here, helping teach here, which I'm very appreciative for. So thank you for that.
Sure.
What specific issues in nursing and healthcare does it address? I guess with what as far as the academic.
Oh, okay. So we're preparing the next generation, right, of leaders and of nurse leaders, of nurses, right? I think all nurses are leaders at some point, and I do believe that nursing is being called to really influence and lead health of the future, and so we have the skills, the knowledge, and the ability to do that. And so now we need to create our nurses into more thinkers, right? And so it's that nurse thinking that doesn't allow us to not just sit at the table, but to set the table and to really lead where we assist in patients, in empowering patients to own their own health. And I think nurses are really in a position to do that.
Great, I agree. Okay. What are the gaps in the science that your research addresses?
So I'm not a primary researcher. I am an implementation scientist, and so we know where the gaps are. The gaps are from research to practice. We're trying to, as DMPs, decrease that gap from research to practice. Where do I think we need some work in our school, or we can really impact, is around the opioid crisis. We're doing a lot of work around that, really looking at the primary care or public and population health arena as a entry to practice for our BSN students. I think everyone thinks they need to go to the hospital, and they really just don't. And then, care transition teams, but also in looking at who's our next educators, right?
Yes.
And so that is looking a little different, right?
Yeah.
So are we including simulation expertise in our educator program? Are we doing those things? And those are what I'm looking at right now. But what really is the strong evidence to support simulation to replace actual clinical time? And I believe there needs to be a little more research around that.
Yeah.
And I would love to do that here at George Mason. Yeah.
Great. So I think you kind of answered this a little bit. What is the significance of this?
Yeah, well, so I think I did too.
Yeah.
And then the impact will be a healthier workforce
Absolutely.
that is prepared to really meet the needs of our populations. Yeah.
So how does this relate to the state and the national policy and priorities?
Well, I think what I talked about was a national priority.
It definitely is.
Which is the opioid crisis, really looking at care transitions and less hospital stays, more community impact out there. Looking at simulation, of course, as because clinical sites are tough.
They are tough,
and changing that level of thinking, and that nurses are embracing that they are leaders, and they can impact healthcare at a policy level, at a practice level, at a research level.
I agree.
Education, really, truly, all of that.
I agree. All right. So what will be better in nursing and healthcare because of your science and leadership, which you have addressed that, right? How does your science and leadership relate to local and state and national policies? We have addressed that. How do you expect to inform or translate your research into healthcare policy?
Well, a lot of that is being done by our students that graduate and then go out there and really do inform. We have a lot of former students that are active in the Virginia Council of Nurse Practitioners at a legislative level. We have a lot of our students that are really at a national level, really talking about what they have done in their DMP projects, in their research, that kind of thing. At a state level, we have a researcher here that's looking at bruising. And we think, well, bruising, what is that? Well, there is different bruising stages that are often not detectable until very late in darker skinned people and that kind of thing. So we're really looking at that as a how can we better improve trauma, trauma care, those kind of things. So
and is there other information that you would like to provide regarding the program, the research, and scholarships that George Mason has to offer, or that?
So George Mason currently has a minimum of 3, or nursing does, has a minimum of 3 to 4 HRSA grants, another 2 to 3 SAMHSA grants. These are all practice grants and training grants that will help our nurses to really work at the highest level. And so that really has given us the ability and the funding and the resources to make that happen. And so at George Mason, we say health starts here, or health is visible, right? And especially through our College of Health and Human Services, where we're moving to the College of Public Health under the direction of Dr. Jermaine Lewis, who is a national speaker on public health initiatives. And so I do see that our university, specifically our college, is really moving forward in meeting the demands of our public, right? And our public's health.
Yes, with the MOP clinics in the area, and we've been I couldn't agree.
So I do think we need to add in there that Mason is one of the first universities that's really been able to not only implement nurse-led clinics, but to grow to 10 clinics that are sustainable and that really do meet the needs of our community.
Yes, we're very grateful for that. What advice do you have for the next generation of nursing leaders?
To embrace their vulnerability and just get out there and see where this journey leads them.
I agree. Well, it's been a pleasure.
It is always a pleasure.
And I will see
Take
you
care.
around. Thank you.